Hello, I'm Dr. Ellie Anshore, and I'm a staff physician at St. Michael's Hospital in Toronto. This is a patient educational video about trial of labor after cesarean section. This is when a woman with a previous cesarean section labors with the goal of having a vaginal delivery. You may have also heard the term vaginal birth after cesarean section, or VBAC, which is when a woman has a successful vaginal delivery when she's had a previous cesarean section.
In general, women who have had one previous cesarean section have two options for delivery in their next pregnancy: a trial of labor, or TOLAC, or elective repeat cesarean section. The second option will be discussed in more detail in a different video on repeat cesarean sections.
There are some women who are not candidates for a TOLAC. These include women who have had multiple cesarean sections, a previous classical cesarean section or T-incision, a previous uterine rupture, a current pregnancy complication requiring a C-section, such as a placenta previa or the need for an urgent birth, a previous cesarean section less than 18 months ago. If you cannot get a copy of the operative report from your previous cesarean section, you may still be able to safely have a TOLAC. You can discuss this in more detail with your doctor to see if you are a candidate.
You may be wondering about why women would want to TOLAC. Some reasons to try TOLAC include a shorter hospital stay, generally a quicker recovery, and no restrictions around heavy lifting. A desire to experience giving birth vaginally, avoidance of major abdominal surgery and the risks associated with an elective repeat cesarean section, such as increased blood loss, infection, and future surgical complications. A greater chance of an uncomplicated birth in the future, and risks related to cesarean section increase with each surgery, especially the risk of having a problem with your placenta. Earlier initiation of breastfeeding and better success with breastfeeding at 3 to 6 months, and lower risks of breathing problems in your baby immediately after birth.
Although there are benefits to TOLAC, there are also some risks associated with it. The most common risk is needing a C-section in labor. Approximately 75% of women who attempt a TOLAC will have a successful vaginal birth. A C-section in labor does have increased risk of blood loss, surgical complications, and infection compared to a planned elective cesarean section. The most serious risk is uterine rupture. This is when the scar on your uterus from your previous cesarean section opens during labor. This is an emergency and happens to approximately 1 in 200 women attempting TOLAC, which means 99.5% of women do not have this complication. If this happens, it can have serious consequences for you and your baby. These include an increased risk of blood transfusion and surgical complications. 15 to 30% of women who have a uterine rupture will need a hysterectomy. There is a very rare risk of serious injury or death to your baby, which happens to 3 in 10,000 women who attempt a TOLAC. Additionally, TOLACs are associated with all of the usual risks associated with a vaginal birth in general, including perineal tears.
There are certain characteristics that will make you more likely to have a successful TOLAC. These include, if you've had a previous vaginal delivery, your chance increases to 82% and over 90% if you've had a previous VBAC. If the reason for your previous cesarean section is no longer a factor in this pregnancy, like a breech presentation or a placenta previa, if your labor begins on its own, if you're less than 40 years old and your pregnancy has been uncomplicated, or if your baby's estimated weight is less than 4 kilos or 8 pounds, 8 ounces.
If you're planning a TOLAC, we recommend you going to obstetrical triage to be assessed when you think you're in labor or if your water has broken. You can have a cervical stretch and sweep during your regular doctor's appointments after 38 weeks, which can help decrease your need for an induction of labor. When you are in active labor, you will require continuous monitoring of your baby's heart rate and regular cervical examinations to ensure your labor is progressing safely. If there are concerns about your baby's heart rate, or if your cervix is not changing, you may require a cesarean section at that stage. Generally, we recommend getting an epidural during labor in case an urgent cesarean section is needed. Oxytocin, a medicine to help give you contractions, can be safely used when your labor begins on its own and will not increase your risk of uterine rupture. Some women plan to have a trial of labor if they go into spontaneous labor prior to their booked cesarean section date, which can be any time between 39 to 41 weeks. Some women want to try a TOLAC even if they do not go into labor on their own, and plan for an induction of labor if they pass their due date and their labor has not started spontaneously. This is safe to do where you've had a previous cesarean section. Please watch our induction of labor video for more information.
If you have any further questions about TOLAC, please read our information pamphlet or discuss it with your doctor. In the summary below, we have links to a few helpful online resources. Overall, both a repeat elective cesarean section and a TOLAC are safe options for your delivery, and both carry very low risks for you and your baby. Thank you for watching.